Does Pelove cause fat loss in the face? If it does, what can I do for recovery? I did Pelove treatment and I found that my face lost volumes and I looked older the next day. I was happy when I did all therapy about 1 month ago, but my face seems like it went back to before my previous treatments.
Thank you for your question. You submitted a question without a photo. However, you describe in your question a situation where you are wondering whether or not Pelove can cause fat loss in your face, and you state that after undergoing Pelove that your face looked older than starting the next day, and that you were pretty satisfied having alt therapy approximately 1 month prior, but you are now noticing that the appearance is regressing to the pre-treatment state. Well, I can certainly share with you my thoughts on this technology and what effect it may have had on your face, as well as some options that I think might be worth considering given what you have been trying to do with these non-surgical treatments. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. The full range of skin enhancement services are in our practice, starting with the skincare products that we've designed to radio frequency devices and lasers and injectables, and of course a wide range of surgical procedures I perform, from eyelid surgery to facelifting surgery, to help our patients look their best. So they're really, I can tell you from a more global perspective as to the common issues that I come across when people like yourself come to my practice who have had similar questions with comparable experiences. So to begin with, I think it's important to recognize some of the science behind these technologies that are the radio frequency devices. And Pelove actually is one of the original radio frequency devices that was used for essentially skin remodeling. And it's based on a particular science where the skin is heated to a certain target level of temperature. And at a certain level, you can get skin remodeling and collagen remodeling, and you can get wrinkle improvement with some degree of tightening. And then beyond that, and sustained, you can get fat reduction. Now, we have a device in our practice for non-surgical fat reduction, in addition to Pelove, which we've had for many years, since the beginning when Pelove was initially introduced to the market. But we also have a long pulse laser device that we actually use a scanner and can do non-surgical fat reduction and skin tightening. So these principles essentially are applied, and it's just a question of what kind of technology is being used. Now, I can tell you that seems unlikely that Pelove would cause fat loss. It is actually, in order to get fat loss, as I described, you need to have a certain target temperature maintained for an extended period of time. And I can say from experience that Pelove's the Pelove approach of using a handpiece to roll over the skin, it's difficult to get the skin to have that high temperature for a sustained period to cause fat reduction. It's not impossible, but it seems unlikely. Now, given that particular technology, and other technologies were also being very aggressively used to try to tighten skin, a lot of people share your same type of story with other modalities. And so understand that when fat is disrupted and reduced, a lot of it is diminished more relatively permanently. However, I have helped a lot of our patients who have had similar situations improve their skin quality using platelet-rich plasma. Platelet-rich plasma has been shown in scientific studies to actually stimulate fat cells. So, in helping people get skin rehabilitation, I have used platelet-rich plasma injection done over, let's say, every 3 months to help improve fat cells, to improve the skin quality, to help recover from some of these very aggressive heating devices where they were not necessarily designed specifically to reduce fat, but were trying to actually intended to tighten the skin and essentially crossed a line where neither the skin got tightened and it actually further aged the skin, and beyond that, they didn't have that much fat under the skin to begin with. It's very important to understand that youthful appearance is not just about smooth looking skin. What I try to explain to my patients is a young person doesn't look tight. A young person we often describe as having baby fat, and therefore when you are using a device that is intended to tighten the skin, you aren't that far away from potentially reducing some fat, whatever the device may be, but with the understanding that it is still requires a certain amount of time in order to be able to get that kind of effect. A lot of times I find that patients don't really appreciate, or people in general appreciate, that the skin is only 2 millimeters in thickness. And further, the fat layer under the skin as we age gets thinner. But in particular, I would say that one area that is fully overlooked, almost universally, is bone loss. People don't understand that as we get older, we actually lose a lot of bone structure. And that bone structure volume loss is really what is the foundational issue that results in the facial aging issues that we all complain about, whether it's deepening of lines, whether it is loss of definition, and what was perceived as excess skin or loose skin. So something to consider, and it may not apply to you since you didn't submit a photo, but I would suspect would probably be likely to be of some value, is an idea called structural volumizing. You see, instead of finding more thermal energy devices to try to tighten your skin, you may want to consider what is the foundation and restore volume from this using this principle. And this principle means that what I'm doing is I'm using a long-lasting hyaluronic acid filler such as Juvederm Ultra Plus or Juvederm Voluma. I'm placing it at the bone level, and when you place it at the bone level, you restore structure and you get this beautiful harmonious balance in the face, whether it's on the cheekbone, the jawline, the jaw angle, or the chin. What often is perceived as sagging and loosening becomes restored. It's kind of like restoring the real basis of what everyone keeps trying to tighten, whether it's with non-surgical treatments such as radiofrequency and lasers, or with surgery such as with facelift. These are all valid modalities, but if you are able to treat the true foundation first, then everything else becomes icing. So anything from a laser point of view, whether it's discolorations or wrinkles, is more about the shine and the enhancement of what is a foundational issue. So I would say think about skin rehabilitation and skin quality improvement with platelet-rich plasma, and think about structural volumizing using this technique to get the volume at the bone level. It's in contrast to putting filler at the skin level, just below the skin or even within the skin, because you aren't going to be able to get enough correction and stability so that it looks natural. A lot of times people don't like the way a lot of celebrities look because they often look pillowy and it looks strange. And that's because the filler is placed below the skin as opposed at the bone level. So I hope that was helpful. I wish you the best of luck. And thank you for your question.